Thanks for tuning in to another episode of Getting to Know You. As always, I'm your host, Jen Dawson, PeDRA's Associate Director of Educational Programs, and joining me today is the fabulous Dr. Cristy Garza-Mayers. Dr. Garza-Mayers is an instructor of dermatology at Harvard Medical School and a pediatric dermatologist. She's an active member of PeDRA, serving as a PeDRA mentor, and she's also received PeDRA research funding, and she serves on PeDRA's Early Investigator Committee. Thank you so much for being my guest on Getting to Know You today, Dr. Garza-Mayers. It's a pleasure having you.
Thank you for having me. It's great to see you.
So, like I do with everybody, let's start at the very beginning. What was it about pediatric dermatology that interested you? Why was this your career path?
I was actually interested in pediatrics first. So I went to medical school thinking that I was interested and knowing I wanted to work with children and with pediatric populations. And I think I tried other things. I think at one point I thought I was interested in gastroenterology, and honestly, I remember I saw my first colonoscopy and I called my husband. I left the room. I called my husband after and I said, I can't do this. And I said, this is not for me. It's an interesting combination of sort of finding the things that you're doing that you like and finding your people, kind of finding the people that you are working with, your colleagues, and then also your patients. And I think that the problems in dermatology were interesting. It just kind of clicked together.
So after deciding that GI was not for you, how did you get that exposure to dermatology? How did that come about?
So initially it was as a medical student. I did a rotation and had exposure in dermatology clinics, and it was actually, of course, first in adult dermatology clinics. And again, it was sort of these moments that you remember where I was working with someone who I just thought it was so interesting that there was one visit that was, skin exam. It was kind of really routine, and then the next visit was this really bizarre rash, and we left the room, and I remember he said that person has CTCL. And I was just sort of like, what are we, how did you know what? And it's such a big diagnosis to give someone, and to just for someone who had seen so many different providers and didn't have an answer for what was happening. And I thought that was great. You just kind of go from one room to the next and have just a mix of things to see. And in dermatology, it's great the way that we get to feel like we're helping people, big or small problems. And I'm sure in other facets of medicine, they feel the same, but it definitely clicked for me. And then I was able to have more experiences. I took an additional year to do some research and to gain some clinical experience, and just kind of went from there.
So you also received your PhD in microbiology and immunobiology. So how did that come about, and where did that fit in with your desire to be a pediatric dermatologist?
Yes, so that actually was before. So I was an MD PhD student. I went into medical school in a combined program, did sort of the first bit of medical school, did my graduate studies. So I worked on Shigella, which causes diarrheal disease, which is part of the reason I was considering GI. And props to GI doctors. I do still think that it's a great field. They do great work. And then I came back into medical school and had the experience, as I mentioned, in terms of rotations. And so I think things have changed a little bit in medical school in terms of getting early exposure. And I think that part of the reason it's so great to see medical students on the early side, or when people reach out and they're interested on the early side, just in terms of making sure that you're seeing everything that you can see before you make a decision in terms of what you want to do. And so that all kind of came before, and then I was still able to get sort of dermatology exposure and research exposure in dermatology as well.
Okay, so that leads me beautifully into this next section I want to talk about. So you talk about getting medical students exposure to a variety of things so they can have more information as they move through their education. and decide on a specialty. So you, I know, are heavily involved in PeDRA's Early Investigator Committee, and you have been serving as a PeDRA mentor for a while now. Thank you. We appreciate that. And you recently were a mentor on an emerging investigator research grant. So talk about mentorship. Why is it important?
I think mentorship is so important at every stage. I think sort of starting at the beginning, thinking a little bit practically, mentorship is key. When people ask me in terms of applying to residency, which is such a feat, I think, as the years go on, I'm so impressed. I think that having someone who has your back, it also kind of helps you to navigate, is so important. And then I think, even at my stage now where it feels a little bit as a new attending, the kind of the fake it till you make it. It's, kind of having someone to bounce ideas off of, to kind of feel like you're not sort of recreating the wheel, that you have someone to talk about with everything from, patients. It's an interesting experience to see patients on your own for the first time, to research projects, and then again sort of mentoring people, knowing how to do that step as well. And so I think that having someone to connect with is so important.
So how did it work being a mentor on a funded project for PeDRA?
That was great, actually. I again, I'm so impressed with everyone that I've come across who is having to go through this process again. And that was actually, it was you were actually involved in it. It was a little bit organic, where we had this mentoring group that was established, that was really kind of to talk through things. And then someone had an idea, and they reached out to me, and I said, "That's a great idea. Maybe we can get you some money for it. You have this thing that you want to do, and it's great, and you're great, and we should get you recognized for it." And I honestly feel just like honored to have been a part of it, because I felt like it was an idea that kind of came from, not necessarily from me. And I was able to kind of help someone else achieve something. And we're still working on it. But it was nice to have every step of that was really facilitated by PeDRA, and even, in terms of us meeting.
It's really fun to watch something like an organic idea that's come out of this, group of creative discussions turn into something, and then be a finished product at the end. You get funding for it, you are working with the mentor mentees. And so it's been fun to watch that project come to fruition. So let's switch gears a little bit, and let's talk about your research interests, and then we can talk about some of the projects that you've worked on.
Yes. So as I mentioned, I have a PhD that is more remote in terms of my interests. But it's interesting to think about how interests evolve over time. And so even within dermatology, for me as a medical student, I was more involved in sort of more adult dermatology research, looking at cellulitis, and then have sort of had different experiences over time. As a clinical fellow at UMass, I was able to work with John Harris, who works on vitiligo, of course. And that was a wonderful experience. It was a combination of my clinical fellowship director was Dr. Karen Wiss, who is wonderful too, of course. And so it was great to have the benefit of the clinical exposure to everything. And then Dr. Harris's group is doing really amazing things in vitiligo. And it was a great experience to kind of get involved and to kind of think about vitiligo as an entity by itself, as sort of something that patients are dealing with, and then sort of get exposure to the whole, the kinds of research that he does. He really does. He has a lab, he does clinical research. It was a great sort of entry point in that way. I've been thinking more about vitiligo as it represents treatment equity. So thinking about patients and their access to treatment, and vitiligo is, really just a window into how that affects, everything that we see in dermatology. So it's been an evolution for me, and I think continues to evolve.
That's really interesting. I'm hopeful that you can get a project or two off the ground in that space. That would be really cool. Yeah. So let's talk about your projects. Like, what are some of the research projects you worked on that really stick in your mind?
So a project that I was really excited about as a fellow and was able to kind of work on and then complete was, again, with Dr. Harris, looking at narrowband UVB phototherapy in pediatric patients with vitiligo and looking to see. So we know in vitiligo that phototherapy works. We know that it works pretty well, actually. But it's sort of anecdotally, or sort of the experience that I was having as a provider was that we didn't really seem to use it a lot in pediatrics. And I was kind of talking to people, asking them, do you prescribe this? Do your patients use it? And I think that there's a number of reasons why it's perhaps not as common. And, I think it's not going to be the thing that gets you. People often say, is it going to give you 100%? And it might not necessarily, but it works really well. And I felt like it was nice to do a project to then have some data behind it to show that in fact it is, you could say potentially underutilized in pediatric patients. And again, not looking at the reasons, that's a little bit more speculative in terms of, when you are doing phototherapy, you're coming into the office 3 times a week. Often you're paying a copay for every one of those visits. You're coming out of school, as a parent, you're coming out of work. So there's sort of other different reasons behind it, but it was an opportunity for me to start to look at how this data looks in terms of looking at vitiligo, looking at children, how it's documented, and ideas, again, sort of moving forward to think about how can we make this better. And I think that, again, phototherapy has been around for a really long time. It might not necessarily be the thing that sort of gets you 100% clear, but it is indicative of how I think things will move forward for patients in terms of, sort of the new kid on the block, of course, is topical JAK inhibitors for vitiligo. And, are people going to be able to access that?
So what can you tell me about your Weston CDA grant?
Sure. So I was very fortunate as a fellow, again, with Dr. Wiss and Dr. Harris. I had another grant, actually, a smaller grant from PeDRA, where we started a small pilot study that's still ongoing, and then was able to, as things have progressed and I've progressed, was able to, I'm honored to have been awarded the Weston. So in the smaller grant, we had a pilot study that is looking at, there is data that shows that there is sensory neural hearing loss and vision loss in patients with vitiligo. And most of it is sort of meta-analysis done in adults. And I thought that was really interesting because one thing in all of the diseases that we see in pediatric dermatology, but in vitiligo, also is you have someone who comes in, they have skin disease, and then it becomes a question of what else should we be worried about. Parents always want to make sure that there's nothing that's being missed. And so, of course, with vitiligo, we always check thyroid function. But it was interesting to me to think if we have children who are being affected with hearing and vision loss, that we don't routinely screen these kids, but should we, is sort of the question, in terms of, you have kids who are at a critical stage in terms of learning and speaking and everything developmentally. And so there is a pilot study that is ongoing where patients who come in then are routed to have a screening that they wouldn't necessarily have otherwise. And so along with that, then within my Weston, hoping to expand that to look retrospectively to see if there, in terms of children who have been seen in the past with vitiligo, and whether they've had testing that indicates that is more prevalent in that population. And then, as I mentioned, also the past work that I had done looking at phototherapy, looking more now that I'm at a different institution, sort of hopefully harnessing the strength of many institutions and many electronic medical records to look at charts to see, again, in terms of phototherapy utilization in pediatrics, and to have a little bit more data in terms of comparing that to adults to be able to say definitively if there is a difference between the two. And then again, as I mentioned, looking ahead to JAK inhibitors. So as these come onto the market and are available for children and then sort of younger, looking to see if patients are actually having access to that. And part of that, in terms of both phototherapy and JAK inhibitors, is doing some survey studies. So just kind of asking patients what their experiences are. Because I am curious to see, I know my own practice, but everyone, of course, is different. And oftentimes when people have seen me, or, when I saw patients with Dr. Harris, they often will have seen other providers and just kind of ask to say, what has your experience been? Has anybody ever mentioned phototherapy to you? Have you ever tried it? Did you, and to kind of just say, oh yeah, it was 30 miles away. Like we couldn't go, just to kind of hear the reasons of if it was never offered or if they didn't do it for other reasons.
That sounds super interesting. I'm really looking forward to what comes out of this project. So as we wind down our interview, I want to introduce a new segment to getting to know you called Rapid Fire Questions. So instead of sharing something explicitly personal or funny about yourself, I'm going to ask you a series of questions that you can answer as quickly as you'd like. Okay, you ready?
Okay.
Okay. So let's start with, what's your favorite book?
It's hard for me to pick a favorite. I can tell you maybe what I read last.
Yeah, tell me what you read last.
Series. Yeah, I'm reading this book called Majesty. It's probably for young adults, but it's about an alternate universe in which if the United States was ruled by royalty. So it's about the like royal family. So it's kind of like a rom-com fiction. It's very light. It's the summer. That's what I'm telling myself.
What show have you recently binged?
We were recently traveling, and we went to South Korea as a family, and so I started watching this South Korean TV show, and I don't know that it's very big or very popular. It's called Soundtrack. It was on Disney, so I was watching just all of them on the plane because I had nothing else to do.
I love it. That's awesome. Okay, let's see. What is a favorite memory you have from your training?
Oh gosh, I'm trying to think. I think it's so funny because it's all the things that when you were doing them, you probably didn't like them, but the things that you remember where you show up for the VA on a Friday afternoon and there's dozens of patients to be seen, and it's like the senior resident brought a bunch of snacks and it's like, let's do it. Like you just kind of, and in the moment it was not, yeah, exactly. It didn't seem like fun, but then looking back, it's sort of just like being there with people. Mm-hmm. Just kind of learning and
all in it together. Yeah, totally. Yeah. What's the best advice you've ever received?
I work with a lot of people who have believed in me. And, just to kind of have someone who tells you, you don't know until you try. Which I guess sort of, my husband's like a big sports guy. So, it's like you miss all the shots you don't take. That kind of advice has probably been the best for me in terms of really feeling like other people, because I'll always do something if someone else asks me to, but then so to have that has been very helpful.
That's great. Okay, last question and then we'll be done, promise. You mentioned that you were on a family vacation in South Korea. What was the highlight of the trip?
I think one thing, just being all together was great, because we had all of our kids there and my mom was there. And so it was a lot of fun. There was one thing, so we were in South Korea, we were on Jeju Island, and there was this particular art exhibit that we went to, and it was this one where you kind of walk through, and it was this multimedia experience, and that was a lot of fun. It was really beautiful, and it was really hot there, and it was air conditioned inside, so that was great too. But no, that was probably one of the coolest things that we did.
Those are amazing. When we were in Japan in May, we went through one of those like experiential art exhibits too.
I didn't realize it was a thing. It was so beautiful.
It was so amazing and so beautiful and tranquil.
And everyone enjoyed it, which was great.
Everyone.
Like the trick on a family vacation where everyone seemed to get something from it.
Yeah. Oh, I'm so glad you all got to do that and glad you got to travel as a family. That's so wonderful. It means so much. Those memories last forever. Thank you so much for joining me on Getting to Know You, Dr. Garza-Mayers. It's been really lovely chatting with you.
Thank you.
Thanks so much to Dr. Garza-Mayers for joining us on Getting to Know You. I hope you enjoyed learning about her research interests and her various grant projects. For other Getting to Know You episodes, make sure that you have liked and subscribed to our PeDRA Pearls podcast channel on iTunes, Google, and Spotify. Or you can head on over to our YouTube channel at PeDRA Research to check out videos there. You can also follow us on social media. We are on Twitter, Facebook, Instagram, YouTube, and LinkedIn at PeDRA Research. For information about the upcoming PeDRA Annual Conference, please visit our website at www.pedraresearch.org or email us at info@pedraresearch.org. The conference will be held in Atlanta, Georgia, November 9th through the 11th, and we hope that you can join us. Thanks so much for tuning in. We'll see you next time.